as we monitor the vaccines, adverse event reports will come up. So what do we know? We have to look at what we know right now, what we know from the assessment that we've done, and then what we do going forward. So with respect to the UK cases, we do know about them. We've been working really closely with our UK counterparts to get additional information about them. We know that those were allergic reactions that happened quite close to after somebody got the vaccine, and that the individuals were treated appropriately and have recovered. In terms of the clinical trials with respect to allergic reactions, out of the close to 44,000 people in the clinical trials, there were 2 cases of allergic reactions that were more on the severe side. One was in the group that got the vaccine. One was in the group that did not get the vaccine. So it wasn't a significant finding in the trials. However, we know that with all vaccines, there's a risk of allergic reactions. And that's why when people receive vaccines, we ask that they remain in the area that they get the vaccine for a period of time, usually 15 to 20 minutes, to be monitored. And that's because we are introducing something foreign to the body, and it is possible to get an allergic reaction, however rare. So in terms of when something does come up with respect to vaccines, we take a look at it. We assess to see whether or not it is even related to the vaccine, and we're still in that phase now. And then we see if there's anything else that we need to change about how the vaccine should be administered, how it should be used, the information that we would put out. So we're still in the phase of looking at the 2 cases, working with our international counterparts, and if there's any change in the way that the vaccine should be used, we will make that publicly available, share that with everyone before the first person gets vaccinated in Canada. So that's with respect to the allergic reactions. With respect to reactions in general, the ones that were found for the Pfizer vaccine have been in line with what we see in other vaccines. So the most common reaction that was seen was a little bit of discomfort at the injection site itself. The most common was a bit of fatigue. And then the next after that was a bit of headache. In most of those cases, they were around the same types of symptoms from the first vaccine to the second vaccine, with the exception of fatigue. People felt a bit more fatigued with the second. So all of the reactions that we had seen were relatively mild, they were short-lived, and then they resolved. We are always on the lookout for more serious adverse events as well. In total, when we look at the overall population in the clinical trials, the rate of serious adverse events was quite low. So it was 2.8% of the population for people over the age of 55 and 4.6% of all serious adverse events for people under the age of 55. So relatively low. We are always looking for any additional side effects, and that's why we continue to monitor. As Dr. Berthiaume has talked about in his response in French, we have both requirements on the company to continue to monitor, and they have requirements to continue to monitor the patients in the clinical trials for 2 years. And then we also have a system for monitoring in Canada with public health officials and Health Canada to monitor all of the doses and the outcomes as well. So there's a very strict system in place. And in fact, these cases being identified is a sign that the system is actually working. They were identified, they're being investigated, they've been shared with everyone, and we're looking into whether or not there are any impacts for Canada.